Dementia. A mental disorder characterized by general impairment in intellectual functioning without clouding of consciousness, characterized by failing memory, difficulty with calculations, distractibility, alterations in mood and affect, impaired judgment and abstraction, reduced facility with language, and disturbance of orientation. Although irreversible because of underlying progressive degenerative brain disease, dementia may be reversible if the cause can be treated. Denial. A defense mechanism in which the existence of unpleasant realities is disavowed, refers to keeping out of conscious awareness any aspects of external reality that, if acknowledged, would produce anxiety. Depersonalization. A sensation of unreality concerning oneself, parts of oneself, or one's environment that occurs under extreme stress or fatigue. Seen in schizophrenia, depersonalization disorder, and schizotypal personality disorder. Depression. A mental state characterized by feelings of sadness, loneliness, despair, low self-esteem, and self-reproach. Accompanying signs include psychomotor retardation or, at times, agitation, withdrawal from interpersonal contact, and vegetative symptoms, such as insomnia and anorexia. The term refers to a mood that is so characterized or to a mood disorder. Derailment. Gradual or sudden deviation in a train of thought without blocking, sometimes used synonymously with loosening of association. Derealization. A sensation of changed reality or that one's surroundings have altered. Usually seen in schizophrenia, panic attacks, and dissociative disorders. Dereism. Mental activity that follows a totally subjective and idiosyncratic system of logic and fails to take the facts of reality or experience into consideration. Characteristic of schizophrenia. Detachment. Characterized by distant interpersonal relationships and lack of emotional involvement. Devaluation. Defense mechanism in which a person attributes excessively negative qualities to self or others. Seen in depression and paranoid personality disorder. Diminished libido. Decreased sexual interest and drive. Increased libido is often associated with mania. Dipsomania. A compulsion to drink alcoholic beverages. Disinhibition. 1. Removal of an inhibitory effect, as in the reduction of the inhibitory function of the cerebral cortex by alcohol. 2. In psychiatry, a greater freedom to act in accordance with inner drives or feelings and with less regard for restraints dictated by cultural norms or one's superego. Disorientation. Confusion, impairment of awareness of time, place, and person, the position of the self in relation to other persons. Characteristic of cognitive disorders. Displacement. Unconscious defense mechanism by which the emotional component of an unacceptable idea or object is transferred to a more acceptable one. Seen in phobias. Dissociation. Unconscious defense mechanism involving the segregation of any group of mental or behavioral processes from the rest of the person's psychic activity, may entail the separation of an idea from its accompanying emotional tone, as seen in dissociative and conversion disorders. Seen in dissociative disorders. Distractibility. Inability to focus one's attention. The patient does not respond to the task at hand but attends to irrelevant phenomena in the environment. Dread. Massive or pervasive anxiety, usually related to a specific danger. Dreamy state. An altered state of consciousness, likened to a dream situation, which develops suddenly and usually lasts a few minutes, accompanied by visual, auditory, and olfactory hallucinations. Commonly associated with temporal lobe lesions. Drowsiness. State of impaired awareness associated with a desire or inclination to sleep. Dysarthria. Difficulty in articulation, the motor activity of shaping phonated sounds into speech, not in word finding or in grammar. Dyscalculia. Difficulty in performing calculations. Dysgeusia. Impaired sense of taste. Dysgraphia. Difficulty in writing. Dyskinesia. Difficulty in performing movements. Seen in extrapyramidal disorders. Dyslalia. Faulty articulation caused by structural abnormalities of the articulatory organs or impaired hearing. Dyslexia. Specific learning disability syndrome involves an impairment of the previously acquired ability to read, unrelated to the person's intelligence. Compare this with the Alexia area discussed terminology. Dysmetria. Impaired ability to gauge distance relative to movements. Seen in neurological deficit. Dysmnesia. Impaired memory. Dyspareunia. Physical pain in sexual intercourse, usually emotionally caused and more commonly experienced by women, can also result from cystitis, urethritis, or other medical conditions. Dysphagia. Difficulty in swallowing. Dysphagia. Difficulty in comprehending oral language, reception dysphagia, or in trying to express verbal language, expressive dysphagia.